Erik Bendiks. I'm an orthopedic spine surgeon here in Atlanta, Georgia with Georgia Spine and Orthopedics. Today we're going to talk about a new treatment for chronic pain management. With my model right here, this shows the anatomy of the spine. We've thought in the past that all pain had to come from the moving parts, which is basically the disc in the low back. That is certainly a source of a lot of pain, but now we've found out that with new research, pain can also come from the bone itself, specifically from the end plates. And this procedure, which is called the Intracept procedure, is designed specifically to target pain that's coming from those end plates. I'm the first doctor in the state of Georgia to do this procedure, and one of the first in the United States to do it. What we're looking at here is the anatomy of the low back, and specifically the bones of the low back. Within the bones of the low back is a nerve called the basivertebral nerve that's inside of the vertebrae or bone of the low back. That basivertebral nerve is the nerve that senses pain that comes from the edges of the bone or the end plates. The Intracept procedure is designed to address the pain coming from that nerve. Here in this image, we're advancing a small cannula through the skin, and that cannula will then be gently inserted into the bone. A curved cannula will then be inserted through that working channel and will be sent directly next to the basivertebral nerve. We'll then insert a radiofrequency probe, which will then send an energy source to that basivertebral nerve to ablate it or burn that nerve away and stop the pain. The Intracept procedure is an outpatient procedure, meaning you can go home the same day. So here at Georgia Spine and Orthopedics, you'll come to our surgery center. The procedure usually takes about 30 to 40 minutes, and then you'll go home the same day. Most patients notice relief beginning at about a week or two after the procedure, but they can continue to note relief for up to the first year. Most of my patients notice the most rapid improvement in pain between the 2 weeks right after procedure and then 3 months after the surgery. Of the patients that I've treated, well over 90% have noted a significant improvement in their pain, and by significant we mean at least a 50% improvement in their pain. And the good news about this procedure is that it's a permanent procedure. This isn't a procedure that you're going to have to come back and get a second or a third treatment for. Once you've had it, that should be done for the rest of your life.